Welcome, Kibukuri. Welcome, Faith. Purity, welcome. Welcome, Finn. Let us wait up to 5 minutes past 4 and we shall begin. Agnes, welcome. Thank you so much for everyone who has joined this meeting. Welcome to One Health AMR initiative. And please confirm that you can be able to hear me from the other side. If you can hear me from the other side, please confirm.
Hello, yeah, I'm Billy Kipkirui. I can hear you well.
Oh, thank you. So at this point, I am going to introduce myself and give each one of you a permission to introduce yourself. Myself, I'm Ogoti Duncan. I'm Ogoti Duncan Mugire. So feel most welcomed as we begin this journey together. So if Faith is allowed, you take the mic and introduce yourself. I cannot hear you.
Oh, sorry, I'm Faith. Happy to be here. I'm a youth AMR advocate. It's on us. I'm recently coming to this initiative. I hope we all going to do well in this program.
Thank you, Faith. We move to Shadrach. Shadrach, you can take the mic and greet us. Yes, Shadrach. I can't hear any voice from your background, Shadrach. Purity, can you hear Shadrach speak?
Hello.
Can you hear
Can you
Shadrach?
hear me?
Yeah.
Hello. My name is Purity Bochere from Kisii County, and I'm glad to be one of the 20 pioneer One Health AMR initiative. Thank you.
Welcome so much, Purity. We move to Agnes. Agnes. Agnes, can you hear me? Agnes cannot hear me, so Kipkrui, can you hear me?
Yes, I can hear you clearly.
Take over.
Okay, so I'm Kipkirui Billy, currently working in Kenya. I'm glad to be here. It takes a lot to be here, but I'm glad to be among you. It really means a lot. I'm passionate about it, and yeah, nice to meet you all. Thank you.
Thank you so much, Kipkrui. We move to the next one. After Kipkrui is, I've received a call from Finicent, so we move to Winnie.
Good evening. I am Winnie Anyango, excited to be amongst you. As we proceed with this initiative, I hope we'll get a maximum cooperation with you. Yeah, we'll have a nice time as you get experience and all that. Yeah, nice to meet you guys.
That's great, Winnie. We have Saitoti. We have Saitoti. I might not be able to know what might be the problem with. Okay, Shadrach, you can take over.
Thank you so much for being patient for me. My name is Shadrach Simiyu Minyei. I'm glad to be amongst you, and I'm ready to work with you, and ready and available to support and also to keep myself and to get the experience. Thank you.
Thank you so much. Welcome, Shadrach. Let's hear from Kipkrui. Kipkrui. That was Saitoti. Where are you?
Hello, I think I
Not
have.
you, the other one.
Okay,
There is
okay,
another one.
okay.
His other name is Saitoti, I think. I saw him join. Yeah, Cairo. Okay, Saitoti cannot be able to speak to us. Agnes, are you in a position to greet us, please? Agnes? Agnes, are you in a position to greet us, please? Tentatively, Agnes is not. Can I assume that she is not with us? That is the assumption. Then now I can invite Faith to greet us as the secretary and give a remark. Faith, can you get me? Can you hear me? Really, I've begun to realize that our networks are not good. Okay, Vincent, that one is understood. Faith, can you hear me? Okay, Winnie, can you hear me?
Yes.
So it's not my network, it's Faith's network. Okay, fine. So let me welcome you to this meeting today and feel most welcomed at One Health AMR Community Initiative. I want to really say that it was not an easy battle to have you here today. It has been up and down, busy schedules, but finally we got a chance to be here. So we are expecting our first guest to be here today to speak to us. He's coming to us from all the way from Saudi Arabia, and currently he's positioned at Dubai. So I really can't wait to hear him speak to us. And as we wait for him to join, let me give you a preview of what is One Health AMR Community Initiative, why mentorship, and what do you expect after these meetings. So this is our very first meeting, and it's an information meeting, and then we shall proceed to our meetings from next week. So I'm sharing a screen of I'm sharing my screen. If you can be able to see my screen, you can confirm to me that you have seen it. Yeah.
You can see it.
Okay, good. So that is fine. I've seen it also. So Nyatichi is saying, hi everyone, Alice Faith. Hello everyone, I'm about to settle in 10 minutes. My network is unstable. Okay, Faith, we have had that. Agnes is saying, I'm happy to be here with you. I'm ready to be part of the initiative. Apologies, I have network issues from my end. So that is clearly gotten. So allow me welcome you again to One Health AMR Initiative. So let me give you a preview of generally what is all about One Health AMR Initiative. So this is a Pioneer 20 initiative, the first cohort. This is a 20 AMR advocates who are going to be mentored and getting skills. And the gap that we want to deal with is the gap between the community and the shelf, the community and the shelf in our country. So our organizational identity. So we have welcome Brother Ari, that is from all the way from Pakistan. So feel most welcomed here. So I'm talking about our organizational identity. So what is our vision? What is our vision? And these three things, I want you to take them in, put them into your minds as you begin your mentorship journey next week. Evaluate yourselves within this three organizational identity. Number one, our vision is a resilient Kenya and integrated Africa where every community is safeguarded by evidence-based One Health stewardship. So I want you to begin thinking about One Health, evidence-based stewardship. Our mission is to bridge the gap between high-level laboratory research and community action by empowering multidisciplinary advocates. Why am I saying multidisciplinary? Out of the survey that we did on beginning the weekend, we realized we have people from the agriculture sector, we have people from the veterinary science, we have people from clinical science, we have people from nursing, we have microbiologists, we have applied scientists, we have biomedical scientists, and others. So we are talking about multidisciplinary advocates. You are a multidisciplinary person because we are not from the same discipline in terms of academics. So our values, what do we stand for? Number one is scientific integrity. Number two is multisectoral unity. And number three is empowerment through knowledge. So what we are doing, the first session that we are talking about is issues with mentorship is all about knowledge empowerment. And then number three is what we call radical transparency, where we are going to see our program, how it is going to learn, and you are going to appreciate that we are talking about radical transparency. The case for urgency. Why is One Health, AMR, an urgent issue? Those who have prior knowledge about antimicrobial resistance, I must say that AMR is a national threat. So by 2050, AMR has been projected to cause 10 million deaths annually. And right now is about 5 million deaths annually, with the highest burden on low and middle income countries, where Kenya is one of them. So we are having those which are called critical, those which are ranked as critical organisms to be taken consideration with by the World Health Organization. Number one is E. coli and K, that is Klebsiella pneumoniae. That is what we call the Enterobacteriaceae family. Then we have unregulated antibiotic use in livestock production. Nowadays, we are getting use of antibiotics in livestock production. So the gap that we are coming in to deal with in terms of our sessions and in terms of our knowledge empowerment sessions is scientific data rarely reaches the rural farmer or the local pharmacist or your mother at home or your brothers, your neighbors, your uncles. So that is the gap that we are talking about. So what are our pillars? We have 4-pillar framework. The 4-pillar framework comes from, number one is mentorship. So scientific know-how through global masterclasses. This is where we have been able to connect our mentors, and you have seen different mentor spotlights, different professors, different PhD holders from different parts of the world coming up to Frontier as mentors to impart unto us knowledge that is relevant concerning AMR. Welcome, Brian. Welcome, Brian. So, scientific know-how. So, we are talking about different people with different knowledge coming in to impart the knowledge to us. Number two, we have integration. Now, integration, how does it come in? The name is One Health. If you understand the One Health approach, is an approach that is being used in antimicrobial resistance frameworks and antimicrobial stewardship framework, whereby we are aligning the humans, the animal, and the environmental data, bringing all of them together to scale policy. So number 3 is advocacy. Advocacy is all about scalable models and standardized toolkits, whereby we have scripts to create AMR awareness. May it be social media, may it be in print media, may it be doing community initiatives, community workshops, community interactions, community surveys, community questionnaires, may it be anything that we are doing in terms of community, going back to meet the pharmacist, going back to meet the agrophets, going back to meet our community members is all about advocacy. And the 4th pillar in this framework is what we call research and development. Research and development. Research and development comes in and it is something that is targeting surveillance and open access data hub. I know that some of us, we are in our undergraduates, some of us, we have gone to our master's level, some of us, we are in our hustling period, whereby you have just graduated and you are in the hustle of day-to-day psych. I want to begin by saying that research and development comes in. While I was seeking for mentors, I went for mentors who are able. If you check on every mentor, you will realize that every mentor has done more than 15 publications. Every mentor has over 15 years of experience. And every mentor is a mentor who is concerned with. Welcome my brother from, I think from India. Welcome so much and feel part of the team. So we have brought together different mentors from different fields who are going to share with us their experience. I want to say that we have the research and development pillar because we want to know how to write good papers, how to apply for grants, how to do what we call collaborations that are able to eliminate all these issues that are leading us to this problem called AMR. So that is our 4-pillar framework. Why 20 advocates? I was asked this question by someone. So this is a pilot kind of approach. We are doing the first 20. Our second cohort is going to contain 100. And after 100, we are going to move to 200. So it's a serial kind of approach whereby we are beginning with few to go to grow. And the advantage of this kind of approach is once you get mentored, you like the program. In our second cohort, you are going to be part of the mentorship team. So feel most welcome. Now, what is our cohort composition? Who do we have in cohort in Pioneer 20? In Pioneer 20, clinical stroke veterinary leads, this is according to the survey that we conducted, that ended yesterday, we had 33%. So they are the largest group in the room. Molecular leads, those people who are doing molecular biology, biotechnology, those people who are doing genomics, those people who are doing microbiology, biochemistry, we are reaching 27%. And then we have policy stroke communication leads. These are people who are interested in sharing with people about AMR, writing, medical writers, people who are going to be grant writers, people who are going to be advocacy writers, people who want to come at the interface between the national action plans and the NGOs and the international bodies. So policy stroke communication leads, they took 20%. And then we have environmental leads, people from the environment, they are 20%. And this data just feel to me that science stays in the laboratories. Science that stays in the laboratories cannot save lives in the community. Why did I reach this conclusion? Because 33%, you add 27%. That is around 60%. Over 50% of our people are in the labs. then you add 20%, the data reveals that 80% of scientists are in the labs, but only 20% of the people are addressing the communities, are addressing the world, are addressing the people in the communication sector. And it is true that between January and March, I did media broadcasting programs on AMR, and all that I collected from such kind of surveys were that our people, the end users of antibiotics, the end people, the last mile of people who are affected by AMR, they are not knowledgeable about AMR. So think about that data. 80% against 20% in terms of policy. So when we map the knowledge gaps, people were sharing their different CAP assessments, areas of mentorship focus. Number one, people, 53% were unsure of environmental AMR pathways. How does environment and antimicrobial resistance meet? 53% were not sure. When you look on lack of confidence in antimicrobial susceptibility testing reading, 40% they lacked confidence in AST. And then neutral on translating complex reports, it is 33%. And then viral stroke bacterial efficacy confusion, 20%. You find someone has common flu, which is a viral disease, but that person is taking amoxicillin, which is an antibiotic. So think about it. It might be me, it might be you. So in one way or another, viral stroke bacterial efficacy confusion formed 20%. What does this data indicate? That amidst the 15 people who submitted their survey, there is a lot of things that we need to learn even as we go out to address the communities in terms of AMR. So global mentors are our clinical excellency. So whom do you expect to meet in terms of mentorship? The first one, who is our part of our advisory team, is Mr. Chipi Takchan, who is coming from the UK, is an infection prevention control antimicrobial stewardship expert. He is World Health Organization recognized innovator in infection prevention and control, and he has a span of over 16 years experience. And that is someone I really love to meet, to share with. So please feel most welcome. That is number one of our mentors. Number two is Dr. Mathafi Kumal, who is a medical doctor, specialist in clinical microbiology. He is an expert in AI integrated clinical decision support and laboratory quality management. So when we are going to reach, when we talk about, you want to understand more about AI integration into antimicrobial stewardship, antimicrobial resistance, just begin thinking whom you are going to choose as your mentor. Then we have Dr. Ajay K. Plajabath, who is a PhD holder in clinical microbiology, but he is a specialist in phage therapy and characterization of drug resistance bacterial strains. Those who want to do a research, understand more about research in new technologies on treatment of multi-drug resistant bacteria, just go on this line of phage therapy. He is going to share much to us when it comes to him. One Health Pathways. So the first one, the first cradle of mentors, they are under clinical excellence. Then we have our second cradle is One Health Pathways. Those who are talking about the approach between the humans, the environment, and the animals or livestock. So the first one is Dr. Fikaz Zongal, who is a PhD holder, who is an environmental engineer, expert in tackling AMR and antibiotic genes in aquatic ecosystems and wastewater. So I think that is where, for me, I am really interested in. Another mentor that we are going to have is Dr. Grace Ukibai Ekunam from Nigeria, who is a PhD holder in medical microbiology. She is pioneering accurate detection methodologies for epidemiological surveillance. I think we are going to have her talk to us in our first session next week. We have been in touch, we have shared about it, and she is like, she wants to be part of us, not only as a mentor, but also as a member of One Health AMR community initiative. Then we have Dr. Dana F. in Hull. She is a PhD holder from the US in the AMU University. She specializes in bacteriophage therapy and genomic annotation for livestock health. She's an animal scientist, so she is coming with us with a rich expertise in animal pathways. Then when we talk about food systems, someone here might be interested in food industry, understanding AMR and AMR stewardship in the food sector. So we are going to have Dr. Lejo Drampul Dosh from Nigeria, a PhD holder in food microbiology. She focuses on how AMR permeates the food chain via fermented consumables and proactive probiotic stewardship. So friends, up to this level, I want you to understand that achieving a sustainable One Health impact means protecting the plate as much as the patient. That is what, while I was sharing with her, that is what she told me, that it is not about the patient. It's also more about understanding you protect your plate, but at the same time you need to protect your patient. So while I was understanding that, I was really moved. Now, what is our 2026-2027 roadmap as One Health AMR initiative? So in January to May 2026, it has been the foundation, whereby we have been doing digital presence. You have seen our page. I began as a newsletter that between this week, I've seen a surge in numbers of subscriptions. Currently, today, we clicked 500 subscriptions in our AMR Dispatch newsletter. So we have our LinkedIn page, we have our Facebook page, we have our WhatsApp wall and our WhatsApp channel. What do I request from us as advocates? Please let us share the links to this kind of our platforms, whereby we can be able to create a digital presence. And if you can be able through faith to create an Instagram page and perhaps a TikTok page, you are free to create and then share with me. You can reach to me on Faith, and she's going to drop the secretary's email in our chat box, in the messages box, so that you can be able to reach to her. So in January to May, we have been doing cohort selection and digital presence people. I want to say that I received over 50 applications to enter cohort 1, but you emerged as one of those who could be able to join this team. So feel most welcomed and feel that you are the reason why we are having this kind of meeting today. Our second roadmap, we are going to move to capacity. From June to August, from next month to August 2026, it is a 12-week masterclass series. I'm going to share with us the program to that 12-week masterclass series. It is beginning June to August. So please begin thinking about it. How do you need to come in? What do you need to do? And how do you need to come in and integrate yourself into it? And then there is what we call intervention phase. Intervention phase is September to December 2026, where we are having 20 localized community projects. I really pray that each of you will get a chance to transition from capacity building to intervention phase, whereby you can be able to run a community project within the month of September and December. May it be doing community workshops, may it be doing meeting your campus students, sharing with them about AMR, may it be doing print media, sharing with people about your patch, about AMR. And then January 2027 to April is about evaluation. That is where we are going to write our first AMR white paper and submit it to the National Action Plan in Kenya, to Africa CDC Action Plan, and we also submit it to the World Health Organization Action Plan. So that is our roadmap for 2026 and 2027. But you understand that cohort 1 is going to end around August. So begin thinking about it. Now, sustainability and scaling. This is all about investment in terms of money. The investment opportunity that we are talking about is a digital hub that is valued to be around $2,500 US. That is a centralized technical repository. And then we have a research and development pilot, which is beginning September to December, that is taking around $8,000 US, according to genomic sequencing in 20 sub-counties in the countries, in the countries that we are going to have. And then we have field stewardship kits. These are the things that we are going to use, valued at around $5,000 US. These are multilingual advocacy toolkits. If you are a Kisi, we are going to ask that you translate AMR kits to Kisi. If you are a Kalenjin, you are going to be required to translate AMR kits to Kalenjin. If you are an Indian, whichsoever language that you are speaking from where you come from, if you are speaking Aramaic, you are going to translate some of these kits to your local language, to Kiswahili, to English, another language that we talk about. And then we have a scaling expansion plan, of which is to 100 advocates in our cohort 2, that is talking about $3,000 US. What is our growth model? Data as a service for global research partners. That is number 1. Number 2, policy integration within our national action plans. That is why I'm talking about Kenya. Someone is talking about Pakistan. Someone is talking about Nigeria. Someone is talking about India. So different national action plans in terms of AMR. Number 3, we are building a professional guild model for certified stewards. It is true that after this program, you're gonna receive a certificate of mentorship. So it's a call to all of us, you join the alliance. So here in this, our aim is that the laboratory has given us the tools to understand life. Now what we need is to ensure that knowledge protects life at the community level. So join us, and that marks the end of my presentation. Now, what is our mentorship program? I think this is one of the things that most of you are interested in. So we are bridging the gap in mentorship and leadership for young African professionals to drive sustainable antimicrobial stewardship and diagnostic equity. So I've shared a lot of these things. I've shared already about the community level gap. So our blueprint for scaled impact is that we are formalizing the Bioneer 20, launching our digital headquarters, executing 20 localized projects, reaching over 15,000 citizens, and expanding our proven blueprint to a national and a network of 100 advocates by 2027. Our strategic direction from here onwards in our mentorship program is to empower a new generation of leaders who are equipped with skills, knowledge, and support needed to contribute to the achievement of sustainable AMS in Africa and the world. So our mission is to raise 10,000 AMR advocates and leaders for Africa and the world's transformation by 2030 through specialized mentorship, ecosystem analytics, and community-led health solutions. So our 4 unbreakable pillars. So number 1 is multidisciplinary mentorship. It's a multidisciplinary mentorship. Number 2 is One Health integration. I've talked about that. Number 3 is scalable advocacy, and number 4 is research and development. So the program is as follows. From April to May is onboarding, and we have done our launch today. So on 27th May is our launch. And then June to July, we are having the foundational phase, where what is going to happen between next week and the end of July? Foundational trainings, peer-reviewed scientific articles, reviews, initial project proposal development, and expert validations. So as you get out of this meeting today, please begin thinking of your proposal, a project that you are going to do to impact your community of influence. That is 1. Number 2, ensure that you attend our foundational trainings. Like next week, we are having our first module, that is Foundations of One Health in AMR, where we are going to talk about zoonotic pathways, resilience, resistance mechanisms, and environmental reservoirs. So begin thinking about those perspectives. Then every week, between a Wednesday and another Wednesday, we are going to have what we call article reviews. We are going to send different articles to different advocates. You read the article, you understand the article, you review, you write a summary of the article of what you have learned. And expert validation. Expert validation comes in whereby we have Dr. Becky, who is doing our review validation. So she's going always to review our summaries after every week. So begin getting yourself into it. Our second phase will be development phase. This is where specialized training in leadership, ground level research, case study development, policy brief submissions, and interactive workshops are going to happen. This is where we are going to have our mentors in different labs demonstrate to us what we have been talking about in phase 1, that is foundation phase. And then the phase 3 is advanced training phase. This is advocate mentor cooperative execution. This is where you are going to talk one-on-one with your mentor. Antimicrobial resistance stroke antimicrobial stewardship, category-based tailored mentorship. And then we have solution pitching. Now, what are the solutions that you begin thinking about to your community in the direction of solving AMR? And then final project report reviews. Then you write your project report and then it goes for review. Those who will go to September and November, that is 2026, this is where we are going to have our certification of successful advocates. We are planning to hold a very good online graduation ceremony, and we are going to have cohort reporting and closure, and we are going to launch our cohort 2 of mentorship. So what are the expected outcomes and multiplier impact? Number 1 is upscaling and capacity building. Number 2 is confidence and self-efficacy. And number 3 is accelerating the national action plan. So that is our program, and that is what we stand for as One Health AMR Community Initiative. So I thank you all for listening to me and getting your time to be here. So at this point, I invite you to ask questions. You ask questions. If you have questions, this is your point to ask. If you have comments, this is your point to make your comments. And if you have inquiries to make, please get it on board and make the inquiries right now. Thank you so much. The floor is yours. Hello.
Hello.
Yes, yes. You can respond, please. You can respond.
Okay, so for me, I think I've been following through. I liked the presentation and the plan and everything. So when I started, I said that it takes a lot to be here. So actually, it was a coincidence that the launch happened. I was in a conference and I had to take this whole time outside just to get to know that what we are doing. So I've enjoyed it, and I think if you give me an excuse today, I might leave anytime from now. Now that I've been I've gotten the entire thing, but I liked it. The flow was okay. I enjoyed the presentation. Thank you.
Thank you, Kip Krui. You can now begin sharing your expectations. Can we begin with Winnie, for example? Winnie, what are your expectations and what is motivating you to be part of this team?
Okay, thank you so much. Yeah, I'm so grateful to be in the midst of you in this initiative. Thank you so much for the presentation. Everything was clear. And from the word go, I expect like learning, getting experience, and getting the best out of my career that will help me as I continue this journey. Yeah, that's all I have. Thank you.
Oh, that's great, Winnie. So we move to Purity. What are your anticipations?
Hello.
Yes, yes, we can hear you.
Yeah, it's raining here. I don't know if you can hear me clearly.
You are very clear to me.
Okay, my expectation from the program is to grow professionally, maybe to go to another level on molecular analysis and on how to solve community problems.
Oh, wow. That is great. We have Saitoti. Saitoti, are you there? Now, Shadrach. Shadrach, are you there? Oh, Saitoti has sent a text and he's saying, I'm so happy to hear from you and ready to begin this journey. My expectation is to be equipped with a skill for scientific research and paper writing to solve the community problem. Wow, that is great. You came here with the same thoughts that I've been having, that mine is to be here and get expert training in terms of writing and solving the community problems. That is wow. The next person here is Saitoti, but Saitoti is not responding. So my next person in the call here, I'm seeing Winners Spoken. Vincent is in another meeting, though joined and being with us. Previous Spoken, yes. Faith, is your network stable now?
Can you hear me well?
That is right.
Okay, my network is not stable.
Yeah.
I apologize for the delay, of course, during the introduction. So I'm Faith. I'm a youth AMR advocate to start with, and I'm a nursing student. And also, I'll be the interim secretary for this initiative. So for this program through mentorship, how can I say? I'm hoping to find guidance from the experienced professionals to guide me through understanding AMR more and its advocacy part, and also to strengthen my leadership and communication skills for the greater community impact. Yes. Thank you, and it's nice to meet you all.
Oh, thank you, Faith. And I'm really happy that I can have people who are really focusing on what we are thinking about. Now, we were to have our first mentor share with us. He is a doctor and he has said he's handling patients over the other side. So, to this point, I will love to say that the initiative has collaborated with, we were with Faith yesterday. By the way, Faith is the secretary to the initiative. We were with her yesterday in a meeting with an African Cooperation initiative that is a Docit Proof Foundation. And we are partnering with various kinds of organizations to see if they can support this initiative so that when we are going to transition to real research execution, real policy execution, whereby you propose an idea, you can go with it to the community, find resources to carry out your practical aspects of the mentorship program. So I received today MOU from Docit Proof Foundation, and I also received an MOU from Nigerian Youth Community of Practice in terms of AMR. We have received an agreement from React Africa. Those who know React Africa here, there is an initiative. We are also planning to have high-end meetings to just showcase that there is a gap that needs to be addressed. So I really urge all of you that you may please attend the trainings every Wednesday, same time, same place. For the next 2 months, every Wednesday, just a Wednesday, and we are going to make sure that it doesn't go beyond 1 hour, 30 minutes. It's just a meeting for 1 hour, 30 minutes. And make sure that you are able to do your article review. You read and understand the article. And once you understand the article, then you can send back the summaries through the secretary's email. Another thing I want to remind all of us is that we are going to have our YouTube channel repository where we are going to reposit every meeting recording that we are going to have. So if you never got a chance to attend the meeting, please check One Health AMR initiative, Pioneer 20. We are going to call it Pioneer 20 initiative at YouTube. So you can check it and then watch it, understand it, and always make sure you go back, internalize what you have been taught, internalize what has been shared, and that is going to make us move forward and grow. Another thing, please, friends, let it be to us that you begin thinking about responding to emails, responding to messages on WhatsApp, responding to messages on our LinkedIn page. Please, rate us not just few, because the only way we can correct feedback is by you sending a response to us. So send forth your response. I love what Saitoti has done. Saitoti has set his email that every moment we send an email to him, it responds back. But I could prefer that we send back our responses. And we are going to have our feedback forms after every session. So please help and come out and share your feedback. Every session, after every session, we are going to have a feedback summary of the session. Please fill for us the summary so that we can be able to compile reports which are going to help us to evaluate this program. I also want to say that we are planning to do a survey. Please, may I see those who are in our campuses, who are currently campus students, by raising up your hands. Oh, none of us. I've seen Winnie. Anybody again who is a student? Well, the others are graduates. That means, so Faith, Faith is a student. Faith, are you a student? I've seen a laser thumb. So we are going to do a survey. It's a survey, you can share it with your cohort mates. We want to correct data in terms of youth understanding of AMR, because this is the grassroots data that we can use to prepare our scripts for our communities. The second survey that we are going to carry out is a survey of our communities. For example, you are at a given place. You can do a survey on antibiotic use, and we can see the level of initiatives that we are going to put forth when it comes to your practical sessions. So please join us as we begin this journey together. Is there another question? If there are not, I'll invite Faith to say something, and then we see what we are going to do next. Yeah. Welcome, Faith.
Hi again, and thank you for the opportunity. Wow, I'm glad to meet the first cohort team, being among the mentees and also the mentors who had joined and who we've been introduced to. I don't have a lot to say right now, but I'm hoping that this mentorship will go well.
Thank you. To that end, I want to propose that we are officially launched, and our mentorship has officially begun. Please respond to our feedback forms today and send us your faithful feedback, and we shall tailor our trainings to the feedbacks that you are going to give. So to that end, I want to appreciate all of you for joining, and I want to appreciate for all of you accepting the call, coming on board, joining a great team to focus on the fight of AMR. I see Winnie's hand raised up. Maybe she wants to say something. Oh, she has dropped it. So have a wonderful evening, have a wonderful afternoon. Please take note that if you want to communicate with us, our official emails, the email where you can reach me is onehealthamrinitiative@gmail.com. And you can also reach our secretary's office through this email. So the email to which you can reach our secretary, shortly I reach to it. Faith, you can pronounce it out.
Let me send it in the chat.
Yes? Yeah, it's faith.secretariat.ohaik@gmail.com. faith.secretariat.ohaik. Good. She has written it. It's in the chat. Please reach to us through those two mails, and we are going to support you and see you grow and see you prosper. To that far, allow me to say that our meeting is adjourned till next week. See you next week, same time, same place, with different speakers. I can't really wait to hear from our first speaker, and I really hope it will be a great learning experience. Yeah, thank you, and bye. Yes, Faith. Yes, Faith. Welcome back.
Almost started the meeting. I was traveling and nikaestimate vibaya. Nilikuwa naona kama nitafika by around 4:10, 4:20.
Yes, can you hear me?
Yes, nakusikia.
You
Hello.
can hear me? Yes.
Yeah, I can hear you.
Yeah, I remembered something. I had to exit that call because it was recording, and
Oh,
yeah, we couldn't continue in the same call.
okay.
Yeah, so
Mm.
what is it and how has it